Hello everyone, welcome to the PPD-1 Release to Patient video number 2. As we talked about in the first video, this is going to be that counseling point where you're about to release it to the patient, the drug is about to be in their hands and leave your pharmacy, and this is really a key point and key portion to working in a pharmacy, to make sure that your patients know what they should be doing when they leave your pharmacy, or at least give them information to help them out when they get home. So this is going to be that point where they sign the HIPAA form, they either accept or will decline counseling, as the HIPAA form will state. And the most important thing I can tell you here is do not assume. Just because somebody doesn't ask you something, just because a patient clicks decline, that doesn't mean that they do not need your help. You have to go through the correct progress or progression to make sure that that patient really doesn't have any questions or knows somewhat what they're doing when they're going to be taking the medication. And that's really our job. Okay, so another thing to keep in mind is it's timely. So you don't want to be standing here for an hour, half an hour with somebody. This isn't an MTM session. This is a real quick highlight, of really what they need to know if this is their first time using it or if they're having issues with their medication. So make sure you're aware of, is there a huge line behind them? Is there no one behind them? Can I take my time with this? So just be aware that it's timely and be very efficient. Open-ended questions. If you go up to somebody and you tell them, do you have any questions for the pharmacist, or do you have any questions for me? Chances are about 80 to 90% of people are just going to simply state no, because either they're in a hurry or they just don't know what to ask you. They don't know anything about this med. The doctor didn't explain it, or they think they might know, but they don't really care much about it. So open-ended questions, how they tell you to take this. Why are you taking this? Is this your first time taking it? Questions that when you ask somebody the question, they can't just answer yes or no, which you will learn more about these next year in P2 year. And then another thing that'll be handy is it a refill or is it new? And you can look in their file. If it's a refill, you've seen that they've gotten it before. If it's new, maybe they've never had it before. Maybe they transferred to your pharmacy. So always ask them, have you been on this one for a couple months now, or is this your first time taking it? And that will kind of open up the conversation. Okay, so SportsCenter has like a top 10 plays, so I'm going to give you the counseling top 3 plays that you can do to be really efficient and make sure that your patients hopefully understand their medications in a short amount of time. So you want to make sure that they know why they're taking it. I'm going to use this example of ciprofloxacin, which is an antibiotic. And a lot of patients do know why they're using the medications. Some of them have no idea why they're using their medications or why it was prescribed. So ask them, why are you taking this medication? Why did the doctor prescribe this for you? And it seems pretty obvious, but like ciprofloxacin is an antibiotic, and most people would come back with, well, I have an infection, or I have specifically a urinary tract infection, a UTI. Okay, so you want to make sure you're both on the same page and that they know why. And sometimes you might not know why, and they might not know why, and that might be reason for you to have, recommend that they speak to their doctor to make sure that we're all on the same page. Okay, so the second thing you want to make sure is they know how to take it. So yes, the bottle's going to tell them take 1 tablet twice a day times 7 days. Okay, for 7 days. But think about it. Twice a day, what does that mean? Is that, can I take one and then wait an hour and take one? Can I take one, wait 12 hours and take one? It's pretty vague. If you think about it, it's not very specific. And to the average person, they might not think twice a day means what you know. Maybe it's 8 to 12 hours and that's what it means. So make sure that they know these things. And this 8 to 12 hour window, you can kind of work with them to see what their work schedule is. What do they have trouble remembering to take it, giving them help with that. So make sure you explain it, and explain that this 7 days is really important. Why are they on it for only 7 days? Why should they finish the 7 days? So kind of get on that page with them. A lot of people will also ask, well, do I need to take it with food or without food? Can I drink with this? Can I have a drink, a glass of wine at dinner? So make sure you hit those points, with or without food. With or without alcohol, or do I need to space it out from something that's, that I do every day? The last thing to highlight is what? What can you expect? It's really what can they expect? And a lot of people will not know this part. This is a really key part to tell people. What can they expect? What are the common side effects? What are the most common side effects? You don't want to be giving people side effects that happen 1 in a million or extremely rare. You want to give them the flat out, these are the most common things to watch out for. And if they do develop those, what should they do? And so I have here, ciprofloxacin. We're using it for UTI. E. coli is the bacteria, which you'll learn later. And they're giving it 1 tablet twice a day for 7 days. And the important thing with this, avoid dairy or milk or anything with calcium in it by about 2 hours. So that's something that I would explain to them, and I'd explain why, so that the patient is comfortable with, spacing it out from those dairy products. Okay, so you might be asking yourself now, well, all this material is nice, like your top 3 highlights, love it, it makes sense, but I just started school, and how do I know what to say? I mean, I don't know what a lot of these drugs mean. I don't know what to counsel people on. Well, these are the things that you develop in time. We just want to make sure that you're getting a flow and you know what the best practices are, so that once you start to learn more and more, you can apply these things and you can take those things that you learn in class and use them. So don't be afraid to ask questions to the pharmacist, the other interns, basically anybody there. And I'm going to show you a few of the basic drug information tools that you can use to look up this basic information, which will be covered in other classes and you'll get extensive training with. But I'm going to show you the basics and where to go so that you know that you can start to look these things up on your own. So check out video 3.